Hi everyone, so we're going to begin with our agenda. Here's what we'll be covering today. We're going to start by defining the problem, then explaining our rationale and our review literature that guided our intervention. We'll highlight how equity and inclusion were embedded in our approach, share our results, and wrap up with key takeaways and a call to action. So, our problem statement. As PA students, and as we already know, being in our third year, PA students need accessible and effective strategies to manage test anxiety due to the high stakes of exams, time constraints, and the lack of mental health support that contribute to poor sleep, overwhelming stress, and reduced academic performance. So, being a third year student, as we already know, it's an extreme change going from an undergraduate program to a vigorous grad program with such limited time to learn so much material. And it's really important that PA students know that they are supported, that we can adapt, we can be flexible, that there are people that are willing to help. Um, and that students shouldn't be shy or embarrassed or ashamed if needing to ask for help. That help should be something that's made normal, especially in such a vigorous program. And it's also important for students to know that they're extremely supported during this difficult time, despite the challenges that they're going to face, that there are ways to adapt and that there are ways to cope and to not have this be at the expense of one's mental health. So here's our rationale. PA students face intense academic pressure with frequent high stake exams, condensed timelines, and limited access to mental health resources. Our needs assessment interviewed PA students across social media from different states and schools. It revealed that 83% of PA students experience high levels of tense anxiety and 58% less sleep than 7 hours before an exam. Additionally, 67 report financial or logistic barriers to accessing mental health support, making formal interventions difficult to access. We also interviewed program faculty. Shout out and thank you to Ms. Sharita, which also helped give us an insight to how students feel. Grounded in these findings and supported by objectives by Healthy People 2030, our program, Calm and Conquer, Managing Test Anxiety in PA School, was developed to address the widespread stress and burnout in this population. Healthy People 2030 emphasizes mental wellness, adequate sleep, and stress management as public health priorities. Our intervention aligns with these goals by providing free, evidence based, self guided strategies that are realistic for busy students to implement.
Review, we wanted to look at the medical students' experience, and we did find across a lot of studies that they do face high academic pressure, irregular schedules, as well as night shifts. And they also face a lot of sleep disturbances, which are linked to their anxiety, their poor academic performance, as well as their reduced emotional regulation. Some of the consequences of poor sleep that we saw in our literature review are increased fatigue and burnout, lower quality of life, and impaired cognitive performance. And it was also associated with physical health risks like hypertension and obesity. And then we found strong support in the literature. For example, the article shown on the left showed the PROMISE, which is a sleep study on medical students, and it showed that personalized sleep coaching did improve sleep quality and reduce fatigue. It combined structured planning, mindfulness, and accountability, which proved that even short, low cost interventions can make a measurable difference in medical students' experiences. Some of the key features are 3 individualized sessions. They were 14 to 21 days apart, and this study used a peer coaching model. Some of the tools they used are the Pittsburgh Sleep Quality Index, some wrist sleep monitors, and fatigue inventories. And they focused on setting personalized sleep goals and tracks the progress of their sleep hygiene, their routine, their screen usage time, and the stress reduction. And it included educational materials and habit tracking through sleep diaries there. And then we also looked at 3 different articles that were published in the Journal of Physician Assistant Education. The first one showed that PA students did report significantly higher rates of anxiety and depression than the general population, especially during the didactic year. And the rates were 65 to 72% higher than the general population. and many avoided treatment due to stigma or academic concerns. And then the second study there found that cognitive test anxiety directly impacted the PACRAT performance of PA students, and that was especially for those who reported forgetting known material under pressure during the exam. And it confirms that cognitive test anxiety does impair academic performance. And then the third article was a wellness program, and it showed that peer supported, self guided interventions did improve well being across multiple domains, especially when the students were empowered to choose their own tools. And then for the commitment to equity, advocacy, and cultural humility slide, I wanted to talk about us as future healthcare providers. We feel that this is our responsibility to ensure that the interventions we create and the care we provide are not only effective but equitable, as well as inclusive and culturally responsive. Our project made a conscious effort to reflect those values at every step in the way. For the first part, the health literacy part, we wanted the tools to be written in a clear, accessible language. It included brief explanations of stress reduction strategies to promote understanding and usage. And for the cultural humility part, we wanted our intervention to allow students to self select wellness tools that align with their own values and preferences. It avoided a one size fits all approach, and it recognized diverse coping styles across many students. And for the trauma informed practices, we wanted to emphasize student autonomy and choice in selecting the tools that would work for them. And we avoided any invasive questions or a mandated participation to ensure psychological safety as well. And for the equity and inclusion, we designed it to be cost free and time flexible to reduce barriers for students with financial or scheduling constraints. So, some of the tools we used are insight timers, sleep tips, study planning, and these all required no subscriptions or special access.
Okay, so we did just want to give you guys a visual of what our newsletter looked like that we sent out to students for this intervention. Like Shauna mentioned, we wanted to keep our readability nice and easy. So on the first page, we just did a quick little introduction, and then we had a nice checklist that students could utilize to stay organized. We also partnered with Amanda's scrub brand, Forward Scrubs, to help incentivize students to participate. And then on the second page, we included links for each of the suggested techniques for students to help it make it easier for students to find these resources and utilize them. So we included a link for the insight timer, a link to the study plan organizer, a link to an infographic with sleep hygiene tips, and then a link to a calm lo-fi music playlist. So, going into the results of our intervention, we did ask questions about anxiety and confidence levels pre and post intervention. So, we asked students to rank their levels of anxiety or confidence on a scale of 1 to 10 based on the average of those responses. Pre survey, anxiety levels were higher than they were post survey. So, that was nice to see. And then confidence, while there wasn't that big of a jump, there was a slight increase in how students ranked their confidence levels. We also wanted to measure hours slept. So before the intervention, there was a split down the middle of students that slept 4 to 6 hours versus 6 to 7 hours. And then post intervention, there were more students that did sleep in that 4 to 6 hour range. And then we had a new category, which is that light blue color of students that slept more than 7 hours. While this isn't the result we hoped to see, it is kind of expected. We all know that before an exam, stress levels go up. You may, stay up later studying, things like that. So this result was interesting to see. We also measured the usage of these wellness techniques. So, pre survey, you can see that dark blue and purple color on the left hand side takes up about, most of that graph, about 80% of the graph. So, most students rarely or never use wellness techniques such as breathing exercises, meditation, structured study schedules, increased sleep, or listening to calm music while studying or pre exam. And then post intervention, we did see a nice decrease in that dark blue and purple, so rarely and never. And then an increase in students that sometimes, and then that new category in orange of often using wellness techniques. Lastly, we also wanted to assess students' perception and usage of professional help, whether that be therapy, psychiatry, things of that nature. So before the intervention, the majority of students reported that they had never considered seeking professional help. And then after the intervention, this number dropped by half, showing a meaningful shift in mindset. We also saw an increase in students currently receiving help from 2 pre intervention to 3 post intervention. So during that week of our intervention, there was one student who did go out and seek professional services. So that was really cool and interesting to see that this intervention was effective in reducing stigma and increasing awareness around mental health resources. Now, looking at the stars of our intervention or the things we were proud of, we went back to look at our objectives. Our first objective was reducing test anxiety levels, and we're proud to say that this data point was statistically significant in reducing anxiety scores. Next, like I mentioned, we looked at sleep quality. So our objective was to improve sleep quality. While this measure here was not statistically significant, we did see that increase in that students sleeping greater than 7 hours, but unfortunately, most students did still report sleeping less than 7. And then we also aim to increase the usage of stress management techniques, which we saw on that graph 2 slides ago. So more students did use these relaxation techniques post-intervention. And then lastly, our goal was to improve academic performance and confidence. And again, this was partially met as the confidence scores did improve, but this measure was not statistically significant.
So, for our barriers, a self guided structure was both a strength and a limitation. One of the things that we appreciated about our model was its flexibility. The students were able to pick the tools that felt most natural to them, which is especially important in a high stress environment such as PA school. However, the flip side of that is that engagement is kind of varied. Some students have intended to participate but didn't have accountability or reminders to actually prompt them to check in. So I think what we would improve in a future version is we'd consider integrating short, low lift check ins, either built into like a class session or through a group text or email thread, kind of just to remind students to try out the tools and feel like they're kind of part of something collective. Um, Next, the reliance on self reported data may have impacted our accuracy. So, our surveys gave us valuable insight into how students were feeling and what they were doing. But because the responses were self reported, there's always a possibility of recall bias or response bias that kind of affects the accuracy. For example, students might overestimate how long they slept or underestimate their stress levels, and that's kind of hard to gauge. Um, what we'd improve is we'd incorporate app-based tracking, like using insight timers or built-in logs or a simple sleep tracking app, things like that could give us more objective data to measure. Even voluntary use of these tools could help us better evaluate real usage patterns. Um, Small sample size kind of limited our ability to generalize because this was a voluntary intervention and it was obviously released pretty close to an exam. So we had a small number of participants. That means that some of our findings, like the improvement in sleep or confidence, weren't statistically significant, even though we did see kind of like a trend in a positive direction. So what we'd improve there is that future versions could be launched earlier in the semester, allowing students more time, and scaled across more cohorts than just one, or even kind of expanding and releasing it to other PA programs to kind of increase our sample size and diversity. This would help kind of strengthen our data and the generalizability of the results. So overall, I think we saw the week before an exam is already packed with studying. So even small asks like this can feel like a lot and maybe not worth the time as much. But despite that, we did see students engage, which was encouraging for us. And still, it reaffirmed the importance of launching wellness initiatives before the pressure hits, like before it's exam week. Building habits early on so that students have those tools ready when the stress amps up. Our call to action. So, first, we really want to normalize conversations around test anxiety and mental health in PA education. As PA students, we're trained to care for the mental and emotional health of our patients, but rarely are we encouraged to kind of reflect on our own. Test anxiety is usually kind of brushed off as part of the process, when in reality, it really does deeply impact performance, sleep, and long term mental health. By normalizing open discussions about anxiety and stress, we create a culture where students don't feel isolated and ashamed. Um, We have some ideas of what that could look like. Faculty starting class with quick mental check-ins, and we've kind of already seen that. Acknowledging that anxiety around exams is common and it's okay. Um, Hosting panel discussions or support groups led by upperclassmen for lowerclassmen could be helpful. Ultimately, this kind of helps shift the mindset from just survive PA school to like, how can we thrive through it? Call to action number 2, incorporate wellness tools into the curriculum, not just as extra add ons, but make them essentials. Wellness shouldn't be seen as an add on or an optional resource. It should be embedded into the DNA of PA programs, just like clinical reasoning or pharmacology or all of these other things that are really built into our curriculum. So we had some other ideas what that could look like: offering a wellness 101 session during orientation, um, linking mindfulness or time management tools into the course syllabi, including guided breathing or short meditations before exams or OSCEs. Shout out Miss Sharita. She would often do that with us. Program-specific therapists or psychiatrists to kind of be there and honed in on the struggles of being a PA student in this program or in any program. By integrating wellness into the actual structure of our education, we kind of reinforce that taking care of yourself is just as important as taking care of your patients. And we give students permission to kind of prioritize their health without guilt. And I think Dr. Maldonado has been really great about that, about you can't take care of patients if you're not taking care of yourself. And she kind of reminds us of that. So more of that. Call to action number 3, empower students with flexible, low-cost strategies that they can actually use. So one of the biggest takeaways from our project is that students will use wellness tools if they're accessible, flexible, and realistic. We're already busy and financially stretched, so the tools that we promote have to match the real life of a PA student. And what worked for us was that our interventions were free or low-cost options, like an Insight Timer for guided meditations or Spotify, like Focus, playlist podcasts, things like that. Free digital study planners like Blueprint. These don't require subscriptions, extra logins, or major time investments. They're easy to start, easy to keep up, and easy to recommend to each other. And when students have ownership over what works for them, they're more likely to stick with it even beyond PA school. Call to action number 4, which was based on feedback. Open-ended questions, why it matters. So recent graduates have firsthand experience navigating the intensity of PA school, from didactic lectures to clinical rotations, and have the most up-to-date perspective on what worked and what didn't, and kind of how we could improve. So how to implement that would be to invite recent alumni to join curriculum review committees or serve as advisors for wellness initiatives. And I think that'd be hugely helpful. Host feedback panels with graduates post PANCE to gain insight on exam prep timelines, burnout periods, and under-supported parts of the curriculum, and use their insights to optimize exam scheduling, because I know that was huge for us, to reduce like back-to-back exams or credentialing stressors, and design wellness programs that are really impactful. And by the benefit of that is that by incorporating voices of those who just completed the program, PA faculty can gain real-time feedback and ensure that initiatives remain student-centered, and that will really improve outcomes for current students and future ones. And I think we just kind of felt like it was important to note that the USC PA program students don't have easy access to some of the main campus mental health initiatives. So ensuring that we do, either by bringing sessions to this campus sometimes, or reinstating the inter-campus shuttle because that was discontinued in fall of 2024, or maybe making some classes, more classes virtual so students have time to travel to the main campus or health science campus to have access to some of the programs that are available to them. It could be a big help to students. Thank you.
Thank you guys for listening to our presentation. We also did include a QR code down here in the corner that will take you to our newsletter in case you wanted to access any of those resources that we offer to students participating in the intervention.